Today we're going to look at eczema. We've looked at several fungal infections that really affect the skin. We have also looked at psoriasis, and they are very important to know about them because we would want to provide a context for something like dandruffs. And that's why you would find that people are trying to treat dandruffs, but then they're not resolving. Mostly it's due to what is causing that. That's why it's very important for you to learn several things that usually happen to your skin. We've looked at the fungal infections, we've looked at psoriasis. Today we're going to look at eczema. And when you talk about eczema, this is an allergic reaction. So this is your body overreacting to something which is either an irritant or something totally normal. So it's an allergy. Allergic reaction usually happen when something very normal, something that's not supposed to cause any reaction to your immune system, causes that. So you have a flare up due to your immune cells thinking that something was a pathogen. Now, we are going to look at several types, but then after discovering that now we know what's causing this, it's an allergic reaction, let's go to the type, because I think in the types, that's when you can be able to tell exactly how we can go to treat this. Although we are going to look at treatments later. So we have several types. And the first one, which is mostly what we refer to when we talk about eczema, this one is atopic dermatitis. Now remember, dermatitis is a broad term. So eczema is part of dermatitis, so it's a type. So we have so many causes of dermatitis. We have viral, we have bacterial, we have fungal, we have so many types. But then today we are talking about eczema, which is a substituent of dermatitis. So we have dermatitis, the big umbrella, and then we have eczema as one. But then we have several types of eczema, and we are looking at atopic dermatitis, which is the first type. Triggers are usually allergens. And by the way, we're going to look at the types. After the types, we're going to look at, we're not actually going to look at the triggers because we know triggers are allergens, things that will irritate you. After the types, we're going to look at the treatments that we have. But one thing you have to understand is also this condition, we don't have a known cause. So we don't have a known cure, but we have treatments that will make things more comfortable or even try to suppress this condition. It's usually chronic, meaning it's something that you can live with for really long. So managing it become very important. So the treatments, we're going to look at several of them down there. And also, let's just continue the types. Now, we have contact dermatitis. We looked at atopic, which is an allergic reaction. But then when it comes to contact, you'll have to come into contact, like physical touch with something to cause a flare up. Now this one, I'm going to divide it into two. We have physical touch, just contact. Something touched you and then you had an allergic reaction. Like for example, you have fabrics, or maybe you have a watch that is made up of a certain metal, or maybe something like rubber. Like for example, you have people who are allergic to condoms. We also have like for example, latex. We have gloves, especially us in the hospital. We have people who are allergic to that. Just that's contact. Now the second type, under contact dermatitis, this is a reaction towards a certain irritant that came onto your skin and caused an irritation. I would maybe mention something like, for example, oils. You've changed the oils, or maybe a certain gel you applied on your skin, or maybe you had a chemical spill on your skin that caused irritation, and this irritation would cause you to have a flare up of the same. The third type of eczema, we have dyshidrotic. This one, you're going to form something like pustula. Now you remember we talked about pustular psoriasis, whereby you're going to find that you have pustules that contains the kind of, I want to compare that with something. By the way, I'll try as much as possible to use images in this because they make my work easier. They make description to become way easier. So I'll try to include them as much as possible. But sometimes YouTube usually don't like me using those a little bit graphical images. In case they do happen to demonetize me, just go ahead and like the video and also share, and also make sure you subscribe to the channel. That's the best way you're going to support me in this one. Anyway, in this type, dyshidrotic, you find that you have blisters that contain pus or just fluid inside, either on the palm of your hand or the sole of your feet. And like I said, they resemble what you said, a pustula. psoriasis. Number 4, seborrheic dermatitis. And this one, the reason I decided to mention this is because it also forms flakes that will resemble dandruff caused by other things, like for example psoriasis, and also a fungal infection caused by tinea, which we call ringworm. So they can give the same results. So this one, you're going to find that you remember we talked about seborrheic when it comes to psoriasis. So they are almost similar. And this is where now you find that people are trying to treat the dandruffs that they have, maybe using a fungal topical application or maybe other drugs, but then the dandruffs are not going away because maybe they are being caused by eczema, whereby if you fix, for example, this is just one approach. You treat the allergy. If you treat the allergy, then they disappear because you're not going to have the scaling. Or maybe if it's psoriasis, you treat the condition by, for example, reducing the amount of cells that you're producing per given time. Because in psoriasis, when your immune cells start attacking your skin cells will produce more to replace the ones that have been attacked. So you produce a lot of them. So if you slow down that, or you use drugs that will lower the effect of your immune system on the skin, then you're going to fix that dandruff. That's why it becomes a little bit stubborn, and especially if the dandruffs that you have are caused by psoriasis, becomes a little bit hard to treat. For eczema, becomes a little bit easier because you just treat the condition and it mostly disappears. Although eczema can be chronic, meaning that it can take really long before it heals, or maybe just it stays there forever. But it becomes a little bit easier when you compare this with psoriasis. We have number 5, hand eczema, and this one is a little bit more interesting, especially when it comes to if you're handling something using your hands. I'm sure you've seen people with issues with their hands, especially the hairdressers, because they're touching mostly chemicals most of the time when they're treating the hair. Or maybe you're doing something that will include using your hands and you're going to touch some chemicals, especially mostly you're going to get the flares in your hands only where you're coming into contact with them, especially the hands this side here. But sometimes you can get them on the palm, on the scales, on this hard part of your skin. Now the cause of eczema is not actually known, like I said, but then we have things that can contribute to you getting them. We call them the factors that can contribute to having the episodes. One is genetical predisposition. If this is running down in the family, it means that most probably it's in the genes, and it becomes very hard to control this because now you already have a loaded weapon. So just something small will just trigger this condition and it just comes back, and you have the flare up. We also have the environment. If whatever contact or whatever allergen that usually cause your flare ups is within the environment, then chances are high that you still get the same episodes after going back to the same I was about to say contaminant, but to the same allergen. So the same allergen, if you go back to the same, you're still going to get the same results. Now, another factor is hormones. We have stress hormones. They are very important when it comes to fight and flight and survival of the species. So through evolution, we really have used the stress hormones. But then prolonged exposure to the same hormones usually cause so many things. Like you've seen, stress can cause so many other things, and one of which is this one here. Now for the triggers, we have allergens, which is something that causes an allergy reaction to your skin or maybe your body in general. Also, we have irritants, something that will irritate your skin or any part of your body. We also have hormones, like we've mentioned, and also the immune system. Your immune system, if it doesn't know what is not pathogenic and what is pathogenic, then it might end up reacting to things which are not even harmful to your health. Now for the treatments, this is a little bit easier compared to psoriasis because here we know exactly much of the approach that we can take. Like for example, we want to relieve the allergic reaction, we use antihistamines. So antihistamines will help in preventing the allergic reaction or just reduce it, because sometimes it can be so severe to a point where mostly the antihistamines we have are not going to be so much effective, but then they really work, they help so much. But then we also have another approach, which is now reducing the discomfort that comes from that action of the immune system. We have anti-inflammatories, and most of them are usually painkillers, and sometimes topical application of steroidal drugs, some of which can also even be injectables. So we can use that to make it a little bit more comfortable by preventing the inflammation. We also have several things that you can do, like avoiding the allergen. If you know, for example, if I touch a certain oil, I'm going to have flare-ups. Avoiding it is part of the treatment. You also have moisturizing your skin to prevent it from cracking due to scaling. Now, the same case that happens to psoriasis, the oils, especially we have coconut oils, we have oils which are very good when it comes to something like this, the flare-ups. We also have light therapy, like we mentioned also in psoriasis. I think you can just go and check for that. We have UV. You can use UV. And this one, mostly you're going to use it in in one way. To try to hide the blemish. What you do is you expose yourself to the sun, and in this case you can do two things. One, you can either reduce, we have drugs that we can use to make your skin a little bit lighter. By doing that, and then you stop using them, and then expose yourself to the sun, then you become darker, so that area kind of fades off. The same case will happen when you expose yourself to the sun, and this will make you to, the skin will gain an extra coat of the melanin, so you're going to be a little bit darker, and this will hide most of the blemish that you're going to get from eczema. Also, make sure that you humidify the room, especially for those who usually get the episodes from low humidity in the air. So just by humidifying the area of the room that you are in, you reduce the chances of the flare-ups. I hope that was educational. Like I said, I'll try as much as possible to include the photos. That will be very helpful in you understanding the conditions. And also I'll be very grateful if you also subscribe to the channel and you make sure that because now I'm back and actually I've not developed like a routine where I'll be uploading. What I know is I'm going to upload so many times in a week to catch up for the time when I didn't have that enough time. Now that I think I have a little bit more time, so I think it's good to just subscribe and you make sure that you ring the bell so that you get to be notified as the first person. Also, by doing so, you are supporting the channel. I'll be so glad to create a community here that we can be able to talk about the health issues and things which are related to our health, because I'm planning to make it just a routine for us to talk about our health, because I've seen so many people suffering because of just lack of just information only. Just by giving you information, I empower you so much to a point you can be able to control several things, and also you can be able to go to the doctor and ask the right questions.